Hello and welcome to Sign High. I'm Alana Best.
Kia ora. My name is Mita Moses.
Everyone, including deaf people, throughout their lives, will need to visit a GP for a checkup or if they or their children are sick. Not everyone knows that a deaf person has the right to book an interpreter for their appointments. So that's why it's important to get this information out to the community about this great service. All interpreters are funded by the Ministry of Health and free for deaf people. Government-funded health seminars should provide interpreters anytime, anywhere.
If my children have an appointment at the doctor's, then I will always have an interpreter with me. That way, my wife and/or I will understand what is going on with our girls and will know what is wrong with them anytime we go to the doctor's.
Hi Aniva, how are you?
Good, thank you. Yeah.
So what is your role here?
I'm one of the general practitioners here, so a doctor by training.
So how many deaf or hearing impaired patients do you think we have enrolled here?
We have about 4 that I personally see, and there's another 3 doctors that work here, so there may be more than that.
When a deaf person comes to see you, do they usually bring someone who can translate for them?
Yes, we try and pre-arrange so that they have a sign interpreter with them when they attend their appointment.
Does a deaf person often bring a support person to communicate or a qualified interpreter with them?
Sometimes they can come with a family member and a trained interpreter. So the family member is often their support person, but the interpreter does all the interpretation of what we're saying for the patient and then relays what the patient has to say back to us.
If you suspect the deaf patient isn't fully understanding what's being said, what do you do?
Sometimes you can see it on a patient's face, and it's about taking a bit of a pause and clarifying with the interpreter. Sometimes it's around medical words that may not have been understood correctly, and it's describing what we're talking about or meaning. That usually makes things a bit clearer for the patient. So yeah, just reading body language, reading signs, and then taking time out to talk about it.
What have you found is the best way to communicate with your deaf and hearing impaired patients?
There's increasing ways that are available now for patients to communicate with us, and I find a lot of our deaf and hearing impaired patients utilise email and utilise patient portals where they're able to look at their own results and then send questions through the portal rather than needing to come in themselves. But most times when they're having a physical checkup, they'll book an appointment and present here at clinic.
Do you have any advice for a deaf person when they go to visit their doctor?
Sometimes it can help to have an extended appointment if they're feeling rushed in regards to using a sign interpreter. It can sometimes be helpful to ask for a double appointment or a slightly longer appointment. The other thing is it can sometimes help to bring things also written down to remind themselves what they wanted to talk about, and that can make it easier to address all the things that they've got questions about.
Having an interpreter at the doctor's visit, how does that make sure it runs smoothly and the best outcome for the patient?
I think that oftentimes it's making sure that the person who's interpreting what you're saying is impartial to decision making in the consultation process and is able to translate what's been said in an impartial way. So that's where an interpreter is really helpful as a GP, because we know that they've been trained professionally to direct translate what we're saying to a patient, and then to direct translate what the patient is saying back to us, and that can mean that we're confident in knowing what the patient actually wants for their health and well-being themselves.
Thank you, Aniva, for your time today, letting us come and interview you.
You're welcome.
Next, we talk to a deaf person about visiting his doctor. Hi, Kim. So having an interpreter or not having an interpreter, how do you feel that makes a difference in an appointment?
Yes, it's much better to have an interpreter with me. The communication's really smooth. If I don't, then I'm forced to try and use lip reading or writing, or trying to pick up from them what their information is all about. But with an interpreter, it's smooth communication.
So using a family member as a communicator in place of an interpreter, how do you feel about that?
No, I never involve a family member to communicate for me. I much prefer a professional interpreter, so that I know I'm getting the full information. Sometimes a family member might decide what is actually important for them, but may not be what is important for me. They can't make decisions for me. I need to make my own decisions. So I need to get the full information from a professional interpreter, and I can make decisions myself.
What about a communicator? Do you trust them to give you the full and accurate information?
I expect the interpreter to give me the full information. They have an obligation to follow their code of ethics, so I expect that from them.
What do you know about Manage My Health? Do you know about that?
Managing my own health. Well, I have certain criteria. Say, for example, I recently had a blood test and I got the results back. Okay, so I can read these. That's clear. Or if I need to make a doctor's appointment, I just email them. I can manage my own communication with the nurse, for example. Say, for example, I had a rash. An easy way is to take a photo of that and to send it to them. All I do is wait a few hours while they check it out and have a look at it, and then they can email me back. And they could say yes or no, or don't worry about it. Managing my own health gives me freedom. Yeah, I get to control my own health. Freedom.
Are there other ways that you currently communicate with your doctor?
Email, or I'll make a relay service call.
Thank you for your time and letting me come and interview you.
Great. You're welcome. Thank you.
Here are some useful signs for when you are unwell or you are going to see your doctor.
Check heart. Check ears. Check blood pressure. Check breathing. Check throat. Sick. Flu. Hot. Cold. broken, sprained, vomiting, weight, prescription, X-ray, check heart, check ears, check blood pressure, check breathing, check throat, sick, flu, hot, cold, broken, sprained, vomiting, weight, prescription, X-ray. Welcome back. Next, we have Catherine to explain to us why it was important to have interpreters at her maternity classes, as well as when she went into labour.
I'm Catherine with a C.
Having interpreting services when you were pregnant were important for the antenatal classes, your scan, and having appointments with the midwife and of course for labour. Can you tell us more?
It's vitally important because not only am I deaf, but so is my husband. So in terms of antenatal class, if there were no interpreter there, we wouldn't go. It's of a vital importance that interpreters are provided because we are able to have the same information about birth, about labour, as our hearing peers in the same class. So as deaf people, we don't want to be surprised when we first encounter labour. So we want to make sure that we are making the right decisions through the information that we're getting, that we're having a birth plan that looks like what we want it to look like. So the antenatal classes is where we get that information and we learn all those things. At the same time, in terms of meeting a midwife, we need to have an interpreter there because that discussion is critical for my health, for the baby's health, and it's very important to have clear and concise information. We could possibly write things down, but it is very time-consuming. And there are lots of medical terms which are well over my head at times. So with an interpreter there, I can have the full understanding of those technical terms. Same again for the scan. We need to know how the baby's developing, and we can ask questions at that time through sign language when the interpreters are present. Again, for labour, we'll have an interpreter there. I realise that some parents prefer to have that private, special family time, and I can understand that. But there are times when I might like advice or might need to change a strategy when I'm in labour. If one thing doesn't work, we might have to try something else. So I can't really imagine trying to write down anything to someone else during a contraction. So it's much quicker to be able to sign what it is I have and have an interpreter there, especially if I need to wait and not push. Of course, an interpreter is vital for all those reasons.
Next, we are having a visit with a nurse to discuss access to information.
Hi, Barbara. What is your role here?
I'm a nurse.
How do you feel it makes a difference having an interpreter at an appointment?
When the person comes to see the doctor, it makes the whole appointment flow a lot easier and a lot quicker and a lot more understanding.
Do you have any previous knowledge of how to manage a deaf client before you had one enrolled?
No, it's been a learning curve.
A deaf person's level of literacy or written English can be anywhere from very poor to excellent. If a deaf client came in with very poor English, how would you communicate?
Yeah, our usual line would be writing, so it does make it a bit more of a challenge.
Are there any other ways that you currently communicate with a deaf client?
We have email, which is what we've currently used. We've very recently, in the last 2 weeks, signed up to Manage My Health.
What's that?
It's an email system still, but it's tailored directly into MedTech. The patient has access to their own notes, their own results. They can make an appointment online. They can email the doctor directly and the doctor can email directly back. Whereas prior, the emails were checked just once or twice a day, so it would take a lot longer to get back to them. This should be a lot more quicker and efficient.
Thank you for letting me come and interview you today.
You're welcome. It's nice to see you.
Welcome back. Now back to Alana for another New Zealand Sign Language lesson.
I feel sick. I've got a cough. I'm cold. I've been vomiting. I think I have the flu. I will check your heart. Sounds good. I will check your breathing. Sounds alright. I will check your ears. Wow, you're hot. I will check your blood pressure. Your blood pressure's fine. Your arm, it might be broken. Get an X-ray on your arm to check. We will see if your arm is broken or sprained. I feel sick. I have a cough. I'm cold. Been vomiting. I think I have the flu. I will check your heart. That sounds good. I will check your breathing. It's all right. I will check your ears. You're very hot. I will check your blood pressure. Your blood pressure's good. Your arm might be broken. I'll send you to X-ray for your arm. We will X-ray your arm and see if it's broken or just sprained. Ask at your own doctor's clinic, maybe if you can register for Patient Portal or Manage Your Health. Also, check out Toolbox for Healthwise. They have some cool sign language videos on there. Check it out.
What is a general practitioner and how can you find out all your information? Toolbox Healthwise is a fantastic way to introduce you to the concept of GP, hospital and health booklet. Clicking on the options, you will get redirected to other websites. For example, clicking on Code of Your Rights, you have been redirected to www.hdc.org.nz/Your Rights video for information on our rights. Patient portals take you to a website to register your name and set up a patient portal so you can access your information 24/7 online. If your local is not a part of Patient Portal service, then check out Manage My Health as mentioned by our nurse, Barbara. www.managemyhealth.co.nz.
Keeping yourself healthy is important. Having a checkup every year is a good idea. Having an interpreter is recommended because you don't want to miss any information that is important.
If you've been watching Sign High, all the episodes up until now, you would have seen that not all services, businesses or organisations provide sign language access or interpreters automatically. So if you do need an interpreter, make sure you ask for one. It's very important. Next time, we will explain more about New Zealand Sign Language interpreters and their roles. See you next week on Sign High. Bye.
Kia ora.